proactive sexual education that will optimize their physical and mental health, thereby strengthening their self-esteem and motivating them to achieve more for themselves. And so why do I do that? I do that because we have a lot of things out there that work towards decreasing women's self-esteem, making them feel less than, making them feel worse than they should. And I think that the more we know, the more we are able to combat that and feel good about ourselves. And how you feel actually really impacts whether or not you take care of your body, whether you seek medical come together, and it's all part of one thing. So if you were here with me on Monday around noontime, we talked about actually two things, because we had some things happen in the news that I thought were very interesting. We had what we thought Halle Berry was pregnant, and it turns out she wasn't. But Janet Jackson has been pregnant and delivered her baby, and we know that those ladies are both 50 years old. So I thought it'd be interesting to talk about those subjects. So if you're interested in talking about or hearing about, hey, Dr. Donna, if you're interested in getting some information about being pregnant after the age of 40, then that would be something you can check out on my videos on Facebook. So I didn't tell you this before, but I am on Facebook, Twitter. I'm on Instagram as Dr. Dawn OBGYN. That's DRDAWNE OBGYN. I also have a YouTube channel. So typically I will take my videos from here and upload them to my YouTube channel so that you'll be able to kind of review and get all the information that way. So let's go to the topic at hand. The topic at hand is 5 reasons to see an OBGYN before the age of 21. Typically, we will tell our young ladies that they don't need to see us before 21 because the main reason they're coming in is because of a pap smear at the age of 21. And that's because we know if we do pap smears on so there's really no need for us to do interventions that we do. And if you do too much in terms of intervention, that can actually adversely affect the ladies. So we try to just limit it if you're coming in for a PAP to come in at 21 or older. But there are reasons to come in before 21. So I have my list because I am post-call. So I don't want to forget anything. So if you see me looking down, that's because I have a list of things because I don't want to miss anything. So first, we're going to go through what we talked about on Monday in terms of 5 reasons to come in before age 21. So the first reason is to really get a good idea of what a healthy body weight is and what some healthy eating practices are. So that's when we talk to our girls about really stressing fruits, vegetables, lean meats, poultry, trying to stay away from fatty food, fried food, a lot of salt, because we know that setting up good habits really can impact you in the future. When you get older, that's when we see disease processes like vascular problems, which can lead to heart attack, stroke, things like that. And all those things are impacted by your diet. And if your diet is really under control and you have a healthy amount of exercise, then those things tend not to occur as often. And when we talk about exercise, that means you're going to do 30 to 45 minutes almost every day of the week. So that means either you're walking or you're swimming or you're getting in a good workout at the club of your choice. But you want to do that at least 5 or 6 times out of the week. That's why I really suggest to my patients, find something that you like to do and build up with that. So that's one reason to come in and see your OBGYN. The second reason is the average age, I'd say for girls to get their cycles about 12 to 14. You may get it as young as 9. You may go as old as 16. But a lot of ladies bring their daughters in, or they bring their nieces or cousins in because they want to make sure that their periods are normal. And normal really runs the gamut. So I usually talk to girls to see how often they're changing their cycle of their pads. Is their pad completely full? And how many days they're having the cycle. Anywhere from 3 to 5, maybe even 7 days can be normal. But typically after you've had your cycle for about 1.5 years, your cycle should be coming every 4 weeks, every 28 to 32 days. 26 to 32 days. That's typically normal. So if that is not where you're following in terms of your new cycles, then we probably want to look into that just to make sure, one, is this just a normal variant, or two, are there other medical conditions that could be causing that? Thyroid disease, there's a factor called von Willebrand's that can give you heavy bleeding. So we need to look into those things and make sure. I actually want my girls to come in before they're actually thinking about being sexually active, before they're active, to talk about birth control options. The reason why I want them to come in is, one, you're not under duress. You're not coming in because you got to start like right away because you got this boyfriend or whatever is happening. So we can come and talk, and I can get an idea of her lifestyle, and we can get an idea of like, will you really remember to take a pill, or do you need something like a shot where you just come in every 3 months and you're still protected? So one of the main things that we do, hey, Dr. Mia, is to have our girls come in early and discuss birth control options so that when they are ready to start sexual activity, they have it at hand. Maybe they've already filled the prescription, so they're good. So along those lines, we also have our girls come in before age 21 to start the human papillomavirus vaccine. It's the HPV vaccine. So the HPV virus has been found to be the main culprit as to why women have abnormal pap smears. Typically what will happen is they will have an infection from the virus, and if the infection is low grade, but it keeps going, and it just causes those cells to start changing from normal to abnormal. Even if the virus infection is over, some of those the cells still will be abnormal, and we have to monitor those with pap smears. So we find that the odds of you having an abnormal pap smear can be higher if you have certain human papillomaviruses, and the chances of you having a pap smear without the virus present is a lot lower. I mean, an abnormal pap smear. And when we're thinking abnormal, we're talking about pap smears that we know at a high risk for you seen. We usually start at about age 9 to 13, and it's a series of 3 over 6 months. So we want our girls to come in before, usually about 13, to get that virus. Typically, our girls will come to the pediatrician of choice, and this vaccine can be given to boys too. But a lot of times my moms are coming to see me and they have a daughter. They ask me about the vaccine, and they'll just bring the daughter in and we take care of them. So the vaccine, birth control options, and another reason I think it's good for young girls to come in, if we can build some type of rapport, then we can get an idea of what type of relationship, romantic relationship they're in. We know that domestic violence can occur at young age, typically at high school. We know that the perpetrators of domestic violence, typically this is a learned behavior, meaning that this is something that they've seen in their families or they've seen in their environment. So it's good to get an idea of what type of relationship they're in, if they're in a healthy relationship, if they're safe, so that we can let them know some of the signs that they need to keep an eye out on to make sure that they are not in a healthy relationship. And if they are, give them some tools and give them some avenues to help keep themselves safe and healthy. So those are the first 5 reasons that I would bring our young girls in before the age of 21. So that's what we talked about on Monday. So I have my list. I told you guys I'll post calls, so forgive me, but I'm gonna look at my little list. So number 6, or the next 5. 1, sometimes you will have some vaginal, may have a strong odor. You may have a change in your discharge, a change in the color. It can go from clearish to white. Maybe it's yellow, greenish, and you know that's different for you. That's a reason to come in, to get checked out. A lot of times ladies will go to the Walgreens or a drugstore and they'll try to self-treat, and typically it's not treated. It's not treated correctly, or it comes back real fast. So I have my ladies, just bring your daughter in or bring the young lady in so we can check her out, make sure she's okay. And if she needs treatment, give her the right treatment and the right medication. So that would be a reason to come in. Now, it's important to note Vaginal discharge in of itself is not abnormal. It is very normal. It's very normal to see discharge when you wipe or in your underwear, whitish to yellow. It may have a odor, but not necessarily a bad odor. So we have to really make sure we're not telling ourselves that any odor down there is bad, because that's not true. You may have an odor or you may have a smell, but it doesn't mean that there's something wrong. So we need to really pay attention to something that's different than what we've had. And if you're not sure, that's a reason to come in. So another reason, I have two reasons, they kind of go hand in hand. One is to get relief if your periods are painful. So one of the things we'll see with menstrual cycles are ladies will develop cramping. Sometimes they'll get it just right before and then they'll be okay. Most ladies will get a little bit before, and then when they come on their cycle, it gets really, really more severe, more painful. So typically I'll have my ladies try make heating pads, old school water bottle on your belly. Some ladies will get some relief from that. For the counter, we can try our Tylenol, ibuprofen, which is Motrin, or Aleve, which is naproxen. So those medications work very well in terms of relieving ladies from the cramps. Typically, I will have my ladies start taking the medicine one full day or 24 hours before the cycle is supposed to come. So most of the times we'll get symptoms that our cycle is coming before the actual bleeding occurs. That's when you want to take the medicine. And I tell my ladies, take it around the clock. So for naproxen, you're going to take that every 12 hours. For Motrin, you're going to take that every 6 hours, and just take it around the clock every 6 hours on the dot. Take it even if you're not really having severe cramps, because most of the times if it's in your system, it will help you to have less severe cramps when they do come. So that would be another reason, and that would be if you have severe cramps. Now, along those lines, we talk about symptoms and signs of premenstrual syndrome and what you can do to help that. So premenstrual syndrome is really, it kind of runs the gamut. Most of the times we know it because we're a little more moody, emotional, we get really angry, or we're near tears, or we're just really anxious. Some ladies find it this hard to sleep. We have physical symptoms. We have breast tenderness. You may feel bloating. You may have that cramping that we're talking about. Typically, those are the top 3 or 4 reasons that my ladies will come in. And then also, we can get some cravings. We know we want either potato chips because we have salt indications that we want, or chocolate. We really got to have some chocolate. I have a lot of ladies that come in for that. So, when ladies come in with those symptoms, they want to know, well, what can I do? This is really a pain. I get this every month. How can I help this? So it's really some simple things that you can do to try to help those premenstrual syndromes. And most of them don't entail taking some medicine. One thing you can really do is try to get your sleep in. Sleep has a lot to do with how severe these symptoms are. So if you can get 6 to 8 hours of sleep, couple of nights before your cycle is coming, then that's really going to help you. The other thing I tell ladies to do is try to, like I said earlier, get that exercise in. It really does help your symptoms, not just the cramping, but your overall day-to-day, how you're feeling, your mood. It helps you with that. And if you get into a regular habit with that, you'll notice that those symptoms aren't as severe. And you don't have to go run a marathon. You can do 30 minutes of walking at a really good pace where you can keep up a conversation, but not that easily, 30 minutes a day. And make sure you're doing it right before your cycle, and you will find that that can be helpful. You want to limit your salt intake, limit your caffeine intake. Those 2 things specifically you want to pay attention to. Make sure you're getting hydrated, getting a lot of water in, getting that fresh vegetables. Again, it all comes back down to what you're eating and what you're doing with your body. And you typically will have better relief and less symptoms when you're doing those things. So those are some of the things you can look at. And again, if you are having the cramping, you can get something like Motrin over the counter, or, hey, Dr. Erica, you can get Motrin, or you can get, and those will help with your symptoms. Okay, let me make sure I get everything. Oh, also, we find that smokers have more severe symptoms. So if you're a smoker, this could be another reason that you may want to decrease it or stop altogether, because smoking tends to correlate with a higher incidence of those symptoms, and they can be more severe. And we also know women that are under a lot of stress. Go figure. That will make your symptoms get a lot worse. So again, I really try to get my ladies to do more exercise, because you really can just increase your exercise, and you may not even need to add any medicine. So get that exercise in, ladies. That's going to help you. So these next two also kind of go hand in hand. So if you come in, we can talk about how you can protect yourself from sexually transmitted infections, and specifically how to decrease your risk for picking up those infections. So basically, that's talking about, yes, Dr. Donna, everyone stop smoking. I wholeheartedly agree. So we talk about sexually transmitted infections. Typically, we're talking about chlamydia, gonorrhea, HPV virus that is sexually transmitted. We don't want to leave out HIV, AIDS, that's still out there. We don't want to leave out syphilis, because I'll tell you, I work as a hospitalist, and I had a young girl come in. She was probably 17 years old, and she was pregnant. She was 28 weeks pregnant, and she had this weird things that we saw with the baby going on, and they did all this testing with her before, but for some reason they tested her again and she was positive. So syphilis is still out there. It is still something that we have to be wary of. So it's still in that bucket of things that we have to pay attention to. So the main thing that we need to do to protect ourselves is make sure that we're using condoms, latex condoms. That is one of the main things you can do if you're sexually active to protect yourself. And you got to use it the right way. You got to use it each act. If we're doing something earlier, you come back, got to get another one. Use it every single time, because it's really important. We don't stress it enough, or we think that it's just with our young teen girls. It's not. I got ladies that are coming in that are my age and older that are coming down with certain things that they did not think they would be coming down with. So really, ladies, protect yourselves in that manner. And one of the other things you can do is, even if you haven't had a slip up, but just, if you definitely have come in and you haven't used protection, it's good to get tested yearly. I always ask my ladies if they want to get tested when they come in to see me for their pap smears, and we try to do it yearly depending on their age and if they're sexually active and a monogamous versus non-monogamous. We try to get you testing every year. And most of my young ladies are really good about that coming in. But if you haven't, if you're coming in for your PAP, don't be offended if your doctor asks if you want to get that done. It doesn't mean that we're making a judgment call. It means that you can do all the right things in your mind and still have something happen where you're having an infection. Hey, Dr. Denise, you're right, syphilis, and she has it, and it's affected her fetus. So get tested. If you're in the doctor's office, even if you're not seeing a gynecologist, because a lot of people will go for their internal medicine doctor or family medicine doctor and get a pap smear. Get tested for STDs. It's better to know than not to know, because what happens is if you don't know and you're continually to be sexually active, then you're passing it along, and you're passing, and it's going through, and it's not a pretty picture. And I have had situations where my ladies bring in their partners so that I can talk and let them know her results. And that's not fun for me either. I don't like that. So get tested. Make sure you know what's happening, and make sure your partner is getting tested too, so you both are staying safe. So I really think that is it for the 5 things from today that I wanted to talk to you all about. Again, it's Dr. Dawn, Chicago's own board certified OBGYN. You can follow me on Facebook, Instagram, Twitter. And what I'm going to do is I have a new group, the Clever Girl crew, that I am going to be giving tips to and giving extra little talks and videos. So if you're on Facebook, you may want to join that group, because some of the things I'm doing, I'm just going to focus on my group, because I'm going to be talking to you. And in the group, I'm going to encourage my ladies to, hey, let's talk about certain things. Give me your questions. What is it you want to know? And I'll be talking to my Clever Girl crew specifically. So look for the club view, all the people that want to come in, so I'll know it's you. And then we're going to start having specific chats just for that group. So I want you all to look out for that. And you can also check me on my website, Dr. Dawn, OBGYN, is DRDAWNE, OBGYN.com. Check me out there. I have a nice audio book, Conversations on Contraception, that's free, that you can download, and you can really get a lot of good information with that. So I have just been chatting away. Let me see if I have any questions. I don't see any questions so far. Thank you guys for really kind of writing down what the highlights and the important points here. That's important so that people can know. But I'm gonna sign off for now. I'm gonna come back and talk to you guys on Monday. I will give a nice preview of what I'm going to be talking about, but I'm going to start talking here on Mondays at 12:30, Wednesdays at 5:30. And if it's different, which only means I'm working and I can't do it, I give you a heads up. But look out for me on Mondays at 12:30 Central Time and Wednesdays 5:30 on Central Time. And if you have a topic you want me to cover, let me know. Drop it either in with a message or join my group and we can talk about it together. All right, guys. Thanks for joining me. I really appreciate you all coming through. And I will see you guys. I have 15 live viewers. Nice. Cool.